as a physician at Burke. I primarily care for patients recovering from neurological injuries. But then when the pandemic began, all of a sudden I was caring for patients with COVID. I just took the challenges head on, and if we needed anything, my colleagues, who are some of the greatest people I've ever had the honor to work with, were only just down the hallway, could ask for help. She doesn't have weakness like the other. We really banded together. Working together and overcoming these challenges and supporting one another, I think, has really brought us closer.
I transitioned from being a full-time therapist to respond in more of a nursing assistance manner of basic needs.
But this is like your maneuverability on the right side.
I think the isolation was probably the hardest part to see because we are really social beings.
So I want to try that out with you to see how that works.
We gain so much from interacting with one another and seeing one face to face. Just the fact that we could be a voice for the patients. And just treating them like we all want to be treated, with respect, with dignity, knowing that despite our bodies having such illness and weakness, that we're still us. Yes, I might be gowned up and have this mask on, but I can still connect with you by seeing you and also hearing you too.
Good afternoon, my name's Bronte.
I got reassigned from my normal role as a speech therapist to a nursing aide. And it kind of helped me to see different parts of patient care from another perspective, which I tried to then now bring into my patient care in my regular role as a speech therapist.
Form an O with your lips. That'll help get the air moving better through your lungs.
There was one patient in particular that I recall. She was actually recovering from COVID. She stands out in my mind because I was still kind of getting used to my new role and what I was doing.
You got it. Good.
So she was very supportive of me, and I was trying to help her to feel as comfortable as possible. And I know she was doing the same for me, so it was kind of a unique exchange.
Your daughter would like to speak to you, so what we've done...
You don't realize how much of an influence seeing loved ones has on your recovery until you cannot see them. So we had to get family involved from a distance. We used a lot of iPads. We used a lot of interaction with patients and physical touch that was appropriate with our PPE just to make them feel close and supported.
All the way up.
We had to get very adaptive with what we were bringing in. Trying to simulate somebody's home environment to prepare them for going home is challenging when you can't use equipment, challenging when you can't have the caregivers there.
Take a few deep breaths for me.
So we did the best that we could, and I think we did a pretty good job.
Throughout the pandemic, there was a sense of community in the hospital that I've never seen before, and that definitely helped ease how all of us were feeling. People were dropping what they were doing just to help out and to make everyone else feel a little bit more comfortable.
In those early months of COVID, I was transitioned from being an outpatient physical therapist and working with numerous patients to working within our environmental department. One of my other therapists and I, we clean doorknobs and rails every day, from everywhere in the hospital to all the other offices and all the other buildings on campus. We talked to everybody, asking them how they were doing, how they were holding up, and to see if anyone really needed that extra tiny little moment just to go and say how they were doing, especially someone who really wanted to listen to them.
I was admitted to the hospital Montefiore for COVID. I couldn't breathe. I was in intensive care for 3.5 weeks. I had developed gangrene, and I didn't realize how bad the infection was going in my leg. I'm walking with a walker already. They amputated my left leg below the knee. They had sent me to Burke for therapy to walk. You need a lot of good people around you who genuinely care for you. My PT is Paul Spano.
I look back at myself, I take that moment to take the step back, and I say, why am I still doing this? Why am I coming into work every day, and why am I putting myself at risk for these people? And it's because I care about them, and it's my honor to. It's my honor when you invest in someone, you care for them. You don't see it as a task, you don't see it as a burden, you see it as a joy, and you see it as a great responsibility that you'd like to go and tackle.